Oh, the Soviets launched Sputnik first? What? There's a second Red Scare? What's my opinion on the decolonization of Africa? Whoa, you guys, enough already. Why don't we all just stay cool? This is the era of the drive-in, baby. Fast food, muscle cars, James Dean. And here at Carpe Drive-In, we don't gab about the Cold War, we grab a cold one instead. Our motto? Seize the night. This video marks the second entry into our series on anti-epileptic medications. Recall that in our last sketch, we covered a few broad-spectrum anticonvulsant medications used for all types of seizures, including focal, focal with secondary generalization, and a whole load of generalized seizures. In this sketch, we'll be introducing the narrow-spectrum anti-seizure medications. Most of these agents will be effective against focal seizures and focal seizures with secondary generalization. To emphasize focal seizures here at the drive-in, notice how this waitress suddenly realizes how paradoxically inefficient it is to wear roller skates while delivering fast food and reaches one arm out to catch her balance. Let this focal, uncontrollable shaking represent the narrow-spectrum anti-epileptic agent's ability to treat focal seizures. I want to emphasize, however, that although some of the following agents can be used to treat generalized tonic-clonic seizures as well, they should be avoided in other generalized seizure disorders, including juvenile myoclonic epilepsy, or JME. They can actually exacerbate seizures in these patients, so check out our first video for more info. Alright, here comes our first customer of the night. Let this classic car remind you of the classic narrow-spectrum anti-epileptic agent, carbamazepine. While carbamazepine used to be considered a drug of choice for focal and generalized tonic-clonic seizures, it's now being replaced by the newer broad-spectrum agents. Remember, too, that this classic drug is ineffective against absence seizures and should be avoided in other generalized seizure disorders such as JME. Carbamazepine works by binding to voltage-dependent sodium channels probably after they change from the activated to the inactivated state. This binding extends the inactivated phase. It's kind of like these salty sodium chip bags tumbling to the ground as our waitress reassesses her life decisions leading up to current employment status. An open sodium chips bag is kind of like an open or activated sodium channel. Shortly after depolarization, an inactivation gate swings shut, only resetting after the neuron is repolarized. That inactivation gate then is kind of like the clip on this salty sodium chip bag holding it shut. By prolonging the inactivation phase of sodium channels, carbamazepine blocks the sustained high-frequency firing of neurons. Although newer anti-epileptics may be preferred for treating those focal and generalized tonic-clonic seizures, carbamazepine is still your first-line agent for the treatment of trigeminal neuralgia. Trigeminal neuralgia presents with episodes of sudden and severe pain in the distribution of cranial nerve 5, particularly V2 and V3. At Sketchy, we symbolize the trigeminal ganglia with 3 gems, naturally. And in this scene, these gems are pretty electrifying, lighting up the night from that neon sign. The pain associated with trigeminal neuralgia is described as stabbing or like an electrical shock. It's usually unilateral and won't last for more than a few seconds, though it does occur repeatedly. The pain is triggered by any stimulus to cranial nerve 5, and this can be chewing, brushing your teeth, shaving, swallowing, and the pathogenesis of this remains unclear. Carbamazepine is one of your go-to agents for initial pain control, reducing pain in over 80% of patients. However, carbamazepine may be poorly tolerated. It's associated with an extensive side effect profile, and many of these reactions are quite serious. The most common dose-related adverse effects of carbamazepine are diplopia and ataxia. Let this absurdly tall stack of patties toppling over as our waitress here unsteadily approaches the car represent that central ataxia and unsteadiness. This is especially important to keep in mind for older patients, who may tolerate higher doses poorly and are at increased risk for falls. Diplopia often occurs first, and it's highlighted here by the misaligned headlamps. That's not going well for her. Inappropriate even. Wait, a water cup to the head? At Sketchy, that can only mean one thing: excess free water retention caused by inappropriate amounts of ADH. That's SIADH to you, Daddy-O. A rare side effect of carbamazepine. This phenomenon is due at least in part to increased responsiveness of collecting tubules to antidiuretic hormone, creating a dose-related hyponatremia that gradually develops over the first few months of therapy. Idiosyncratic blood dyscrasias are some of the most concerning adverse effects associated with carbamazepine use. Leukopenia occurs in approximately 12% of children and 7% of adults. It may be transient or persistent and doesn't usually require immediate discontinuation of carbamazepine therapy. However, fatal aplastic anemia and agranulocytosis can occur, most likely within the first 3 or 4 months after initiating therapy. Agranulocytosis specifically is illustrated here at the drive-in by this sand timer with falling granules. It's meant to evoke an image of the falling levels of granulocytes in the setting of bone marrow suppression. White blood cell counts less than 3,000 per microliter or neutrophil counts below 1,000 per microliter warrant either a decrease in carbamazepine dose with frequent white blood cell monitoring or drug discontinuation entirely. Drug interactions involving carbamazepine are almost exclusively related to the drug's hepatic enzyme-inducing properties. See that CYP 450 license plate attached to that chrome bumper? Let it remind you that carbamazepine is a potent broad-spectrum inducer of the cytochrome P450 system in the liver, increasing the metabolism of numerous substrates including warfarin and other anti-seizure agents. Carbamazepine can also cause a rare, potentially life-threatening drug reaction with eosinophilia and systemic symptoms, or DRESS syndrome. It can occur 2 to 8 weeks after exposure with symptoms of fever, generalized lymphadenopathy, facial edema, and diffuse morbilliform skin rash. And since lab studies show eosinophilia, we've sketched in this DRESS with eosinophilic spots. Carbamazepine has also been associated with major fetal malformations. As always, whenever we want to remind you of teratogenicity, we'll sketch in that teratogenic tarantula, this time incorporated into the cool leather jacket of this greaser over here. Stay gold, pony boy. Stay gold. Many anticonvulsants appear to be implicated in fetal dysmorphisms such as hypoplasia of the nails and distal phalanges, hypertelorism, and characteristic facial features including broad nasal bridge, long upper lip, and maxillary hypoplasia. However, let this long, bent, neural tube-like exhaust remind you of carbamazepine's specific association with neural tube defects, spina bifida in particular. Lastly, carbamazepine has been associated with Stevens-Johnson syndrome and toxic epidermal necrolysis, or SJS-TEN. Most cases occur during the first 8 weeks of therapy. Our recurring sketchy symbol for SJS is a red mask getting removed, depicting the classic sloughing rash that incorporates mucous membranes. In this scene, though, it's just a prank being pulled by one of the greasers, don't worry. I guess he just had that creepy Tengu mask lying around. I don't know. It was the 50s. You got bored, okay? This possibly fatal reaction is significantly more common in patients with the HLA-B1502 allele, which occurs almost exclusively in patients with Asian ancestry. Screening for this allele in patients with Asian ancestry is recommended prior to starting carbamazepine. Alright, now on to our next narrow-spectrum antiepileptic agent, phenytoin, one of the oldest anti-seizure drugs around. This classic drug will be represented here by this classic phenytoin tow truck, called to the drive-in because all the ruckus caused by these greaser hoodlums. Just like carbamazepine, this drug used to be a first-line agent for focal and generalized tonic-clonic seizures, but is now being replaced by the newer broad-spectrum drugs. Phenytoin is also ineffective against absence seizures and should be avoided in other generalized seizure disorders like JME. Additionally, like carbamazepine, phenytoin prolongs the inactivation of sodium channels and blocks the sustained high-frequency firing of neurons. So again, on the ground next to the tow truck, we've strewn more of those inactivated salty sodium chip bags, complete with those inactivating clips. The side effects of phenytoin therapy are similar to those caused by the other agents in this group. Ataxia will once again be represented by the unsteady hands of one of those roller skate waitresses, causing that tall stack of hamburger patties to topple over. Other common dose-related adverse effects include diplopia and nystagmus, highlighted here by the misaligned headlamps. Low folate levels and megaloblastic anemia have also been reported, but the clinical importance of these observations is unknown. Nevertheless, we've illustrated that drop in folate levels with this salad here, thrown onto the hood of the tow truck as this roller skating lady wonders what workers' comp is like in 1955. Gingival hyperplasia is known to occur in at least 50% of patients who have had 3 to 4 months of phenytoin therapy. Expanding gums, just like this expanding bubble gum here. The mechanism is associated with an increased expression of platelet-derived growth factor, leading to proliferation of gingival cells and alveolar bone. Hirsutism also occurs to some degree in most patients, as well as coarsening of facial features, hence the coarse facial hair. This can be especially unpleasant for women. Not for him, though. I like the cut of his jib. So rugged. Anticonvulsants such as carbamazepine and phenytoin are also associated with a drug-induced lupus syndrome. So as a little reminder, we've included our recurring sketchy symbol, a lupus wolf, the tow truck driver's trusty companion. Have you ever tried arguing with a tow truck driver who's accompanied by a wolf? Like with carbamazepine, phenytoin can also cause a rare, potentially life-threatening drug reaction with eosinophilia and systemic symptoms, or DRESS syndrome. And to convey eosinophilia, we've sketched in this dress with eosinophilic spots. Patients can develop a rash with phenytoin, and if they do, they're also more likely to develop one with carbamazepine. Phenytoin has been associated with Stevens-Johnson syndrome and toxic epidermal necrolysis, particularly during the first 8 weeks of therapy. As with carbamazepine, this potentially fatal reaction appears to be more common in patients with the HLA-B 1502 allele, which occurs almost exclusively in patients of Asian ancestry. Our recurring sketchy symbol for SJS is, of course, a red mask getting removed, depicting the classic sloughing rash that incorporates mucous membranes. They must be members of some kind of Tengu street racing gang. Is this a beatnik thing? Beatniks. They think they're so cool. Just like with carbamazepine, phenytoin has also been associated with major fetal malformations. As always, whenever we want to remind you of teratogenicity, we'll sketch in that teratogenic tarantula. Again, it's incorporated into a cool leather jacket of one of these outsiders. Orofacial clefts, cardiac malformations, and genitourinary defects are the most commonly described malformations. To remind you of cleft palate specifically, we've incorporated an obvious cleft into the bill of that phenytoin trucker hat. Also, you see that CYP 450 license plate attached to that chrome bumper? Like carbamazepine, phenytoin is a potent broad-spectrum inducer of the cytochrome P450 system in the liver, increasing the metabolism of numerous substrates including warfarin and other anti-seizure agents. Phenytoin is also associated with altered bone and mineral metabolism and decreased bone density. I mean, just look at that porous, fractured axle. This is related in part to the induction of cytochrome P450 enzymes as well as increased vitamin D catabolism. Calcium and vitamin D supplementation as well as bone mineral density testing are suggested in patients on chronic therapy. Okay, pop quiz. A patient suddenly develops sustained, generalized tonic-clonic convulsions for 30 minutes without fully regaining consciousness between episodes. He's urinated, he's biting his tongue. What do you do next? First of all, you need to recognize that this is status epilepticus, and that's why we've included this order status display in front of the diner. Historically, status epilepticus was defined as a single epileptic seizure of more than 30 minutes in duration or a series of epileptic seizures within 30 minutes without regaining consciousness between events. Turns out this definition is a bit outdated, and clinicians now define status epilepticus as seizures that have continued for more than a few minutes without recovery in between. This is a life-threatening emergency requiring immediate cardiovascular, respiratory, and metabolic management plus pharmacologic therapy. A benzodiazepine such as diazepam or lorazepam is the most effective agent available for stopping attacks, and it's usually given by direct IV administration. So, when your order is up, head over to Ben's Diner, our recurring setting for all that is benzodiazepines. Check out our Lego My Benzos sketch for more info about benzodiazepines. Once status epilepticus is initially controlled, maintenance therapy usually consists of IV phenytoin or fosphenytoin, so the phenytoin tow truck is oriented under the order status sign as well. Your patient is not responding to benzos or phenytoin? Start IV phenobarbital. High doses of phenobarbital will control almost any seizure, but at the cost of substantial sedation and potential reduction of blood pressure and respiration, so watch out! Our recurring theme for barbiturates like phenobarbital is a barbershop, of course, like this one. Phenobarbital and the related barbiturate primidone have classically been used to treat partial and generalized tonic-clonic seizure, but their use has largely been supplanted with less sedating agents. Check out our barb shop sketch for more info. Alright, up next, gabapentin. Gabapentin and the related agent pregabalin are narrow-spectrum anticonvulsants sometimes used as add-on therapy for refractory focal seizures. In this sketch, gabapentin and the related agents will be represented by this ice cream truck. Gabapentin, grab a pint. Don't let the name fool you though. It may sound like GABA and even look like GABA, but it sure doesn't act like GABA. It turns out that gabapentin and pregabalin bind avidly to voltage-gated calcium channels, which may inhibit inward calcium currents and attenuate neurotransmitter release. Just think of this freezer door here, usually open and activated, serving you that 1950s classic Calci-Yum ice cream. Well, now this door is bound shut, to preserve that frosty freshness. So yeah, gabapentin has pretty limited use as an anti-seizure medication. More often, you'll see it being used to treat neuropathic pain. Both gabapentin and pregabalin have proven efficacy in several neuropathic pain conditions, including postherpetic neuralgia and painful diabetic neuropathy. Look for a chronically frayed wire like this one leading up to the machine whenever we talk about the treatment of chronic or neuropathic pain. That Diaswedes machine, of course, highlights diabetic neuropathy specifically. These agents have also been shown to be effective in the treatment of fibromyalgia, a condition that involves widespread pain in muscles, joints, and soft tissue locations, all in the absence of distinct lab or physical exam findings, just like the absence of distinct flavor or nutritional value in our recurring symbol for fibromyalgia, fiber bars. At Sketchy, the varicella-zoster virus, or VZV, is represented by Zeus, the god of thunder, and that lightning-y neuropathic pain. Most cases of acute herpes zoster are self-limited, although the pain can cause significant suffering, particularly in older adults. After the rash has subsided, postherpetic neuralgia can persist, consisting of pain that is burning, sharp, or stabbing, and it can be constant or intermittent. More than 90% of patients with PHN also have allodynia, defined as pain evoked by normally non-painful stimuli such as light touch. Gabapentin and pregabalin have shown efficacy in reducing the pain associated with postherpetic neuralgia. TCAs may also be effective, and be sure to check out our tricyclic dodgeball sketch for more info. A couple of side effects to mention. Gabapentin and pregabalin can cause dose-dependent dizziness, sedation, and, as this unsteady and excessively tall ice cream cone illustrates, ataxia. Keep in mind that these toxic side effects are more common in older patients, putting them at an increased risk for falls. Remember, gabapentin does not, I repeat, does not bind to GABA receptors. I know, I got you all excited for GABA and all. So let's wrap up the scene with two anti-seizure medications that do affect GABA transmission. Oh, transmission. I get it. At Sketchy, GABA is symbolized by the GABA cab, and over across the street from the diner is the local repair shop where the GABA cab is getting a lift, if you will. Let me show you what I mean. Vigabatrin is an irreversible inhibitor of GABA transaminase, the enzyme responsible for the degradation of GABA. This produces a sustained increase in the concentration of GABA in the CNS, providing tonic inhibition. Transaminase kind of sounds like transmission, so just think of this vigabatrin cab transmission that's broken down now getting fixed by the repairman, kind of like inhibiting the breakdown of GABA, right? On the other hand, tiagabine is an inhibitor of GABA uptake, prolonging the inhibitory action of synaptically released GABA. So instead, think of this tiagabine necktie getting caught in the cab, preventing it from being taken up. Both these medications increase GABA concentrations in the CNS and can be used as adjunctive treatment for partial seizures. Well, that about wraps it up. Remember, carbamazepine, phenytoin, gabapentin. These are your narrow-spectrum anti-seizure medication. They do not provide much use for treating absence seizures. In our next sketch, though, we're going to be talking to you about... Hey, I've been looking for you all over, man. You're supposed to be the fastest thing in the valley. Oh, are we doing this? For pinks? First stoplight, man.